extensive experience designing, implementing, and evaluating home and community-based service systems for older adults, individuals with disabilities, and long-term illness for the federal government, states, and private sector clients. Today, this presentation will be interactive. It will include polling and discussion. We will be recording this session to make the information available for those who could not attend today. You will find a link to the presentation on the Trust website a few days after this summit. The question and chat functions will be actively monitored. We want your questions and comments. We want to hear from you. And please do respond to the polls. The information you provide through the polling feature will help us determine what information is helpful to you during the summit today and for future presentations. Without further ado, here's our first presenter, Mystie Rail, Executive Director of Assistive Technology of Alaska.
Hello, everybody. Hold on just a second where I found my mouse. It has disappeared on me. Thank you, Kelda, so much. I really appreciate it. For those of you that are not familiar with Assistive Technology of Alaska or ATLA, common question I get is, why do we have an L in the middle of that? We used to be called Assistive Technology Library of Alaska, but people kept trying to drop books off. So we got rid of the library, and now it's just ATLA, or Assistive Technology of Alaska. We are a private nonprofit. We are statewide. We're fully comprehensive resource center. And we're one of the only, as far as I know, the only nonprofit that serves Alaskans, no matter their age, their disability, or where they are in the state. So as long as they live in Alaska and they have a need and they do have to be alive, then we will serve them and work with them and try to find them, provide them with informed decisions about assistive technology, and that might best meet their needs either at work, at school, home, or just in their life. Our mission is very simple. It's to improve and enhance the quality of life for Alaskans through assistive technology. So as I said, we are statewide. These were some numbers from our annual report a couple years ago. We did 165 trips across the state, just a little over 650,000 miles in a year, everywhere south central to southeast. And now we are continuing to do that, but virtually through just about any kind of distance delivery system that you feel comfortable with. We will do FaceTime, Zoom, GoToMeeting, anything that you would like. And just to give everybody on here just a very brief overview of what it is ATLA does. Our broad kind of providing services all the way around for everyone is we provide outreach and information and assistance. We do device demonstration. We work with a lot of partners all over the state and have devices placed everywhere from the peninsula to Barrow that people can go have a demonstration, or we'll do it virtually. We also have a short-term loan process so that if someone wants to try things and they're not sure if it'll work for them, we can provide that to them. We have long-term rental, and we also provide acquisition services, which means I have a full-time staff that all she does is, if you're having trouble finding funding for the AT you need, that's her job. She will help you do that. And then we do reutilization and state financing. With state financing, what that means is we obtain additional programs and grants so that we can provide the AT and the services to people. What we do not do, though, is we cannot bill insurance, Medicaid, or Medicare, and we cannot provide durable medical equipment. So we are not the ones to call if you need a new wheelchair. a new adjustable bed, anything like that. So we took the time, my staff, this last week and did some short videos, some interviews of some professionals that we've recently helped through a few of our programs. So I'm going to show you those videos now.
My name is Adriana Shipowick, and I am the clinical social worker at the Alaska Veterans and Pioneers Home here in Palmer, Alaska. The biggest barrier that we have seen due to social distancing were the residents' inability to see their loved ones and to hear their loved ones. Even with the use of a telephone, it has been extremely difficult for them. Technology has been just a lifesaver for many of our situations that we've come across. Not only did the residents get to see their loved ones via FaceTime or using some other video platform, we were able to connect relatively small devices such as a telephone to the TV or to a larger screen so that they have an opportunity to see their loved ones in a larger image. Technology has also allowed us to maintain church services within our home, and church is such a huge part of their life. It has allowed for them to continue to see their physicians and have physician assessments or other provider assessments.
My name is Julie Swanner. I'm a speech language pathologist with a home health agency in the Mystie Valley as well as in Anchorage. COVID has made a huge impact with my clients. I see patients as they're coming out of inpatient facilities, hospitals, or rehabilitation treatment centers, and they're already at risk for isolation and depression. Being able to contact someone and talk to a person directly to get what you need and say, here's what's going on with them. But also the response from ATLA to my patients, giving them a call and saying, hey, Julie mentioned these things that would be really helpful. Is there anything else going on that we can do for you? That's been huge, because they don't feel so disconnected from making those decisions, and they have so many options available and things that I may not think of because it's outside of my scope of practice. But the representative at ATLA has been able to call and say, hey, we also have this. How about we set you up with that as well? So it's been amazing. It's been absolutely amazing. And all of the patients that I've worked with and who have been getting things have been absolutely overwhelmed. There's another item that I've recommended for people that I didn't mention earlier, but it's a phone that has stored numbers in there with bases of family and friends, so they can just hit one button and contact them. That's been huge with being able to stay connected and to feel like they have access to the outside world again. They're not in this alone. They have that support still there and easy to get in touch with people and just to call and chat or ask for help, whatever. It's been amazing.
So those are just a couple examples of some professionals that we've worked with. We've of course worked with them in the past, but since COVID, they have become our hands out in the home health and within the senior centers, within a lot of places, and we couldn't do it without those guys. So I believe Jan has a poll now that she's ready to show.
And I'll introduce this. Hi everybody, I'm Kim, and you do see a poll on your screen unless you've just called in. And the poll's questions are, it's asking how you have personally benefited from technology. So as we move into our interactive discussion, we thought it would be helpful to just reflect on how we've all benefited during COVID personally with technology. And so you can see the results as we are live in action as people vote. And this is the first of 5 polls, so it will be informing us as well. And on this topic, we'll take this information. But it looks like lots of people have been telecommuting for work is one of the lead ways people have benefited from technology. Many of us are benefiting from social engagement. So it looks like telehealth is also definitely a leading category. Almost everybody's voted, so we will be closing the poll in just a moment. And if you have other things that are not listed, other ways that you've benefited from technology, we would love that to be entered in the Q&A. Again, that informs us and just broadens the thinking. So it looks like most people have voted. Do we want to end the poll? So the lead answer is around employment, and then going to social engagement, telehealth, public engagement, community outreach, and then I know there's some people entering in some other things in the Q&A. And really,
we're saying hobby research and inspiration, and other people that are willing to learn more about it.
Okay, great. All right. So we'd like to move into our discussion, and this is an opportunity for all of you out there to let us know. I think COVID, for me, I've been working on technology related to human services for the past 2 years. It was actually 2 years ago that Health Tie, which some of you may be familiar with, was launched, and we were looking at how do you bring technology in. And we've had some interest, but the interest and engagement since COVID started has just been really skyrocketing. And I think Kelda, in her introduction, when she said we've all had this huge learning curve, really nailed it. You know, how do you support and continue to support people in a safe way during COVID? I know there are people online who have been doing this and are some of those early adopters, and we want to hear from you. We want to hear what are the lessons in both positive ways that technology has benefited the people that you serve, provide services to you, or you as a person who maybe receives services, and also the challenges that we've learned. And how we're going to do this is we are monitoring the chat and the Q&A. Might be easiest to enter your thoughts into the Q&A, or please raise your hand if you'd rather just share from your own experiences how you have used technology and some of your thoughts. We have a lot of people online, so I encourage people to keep it fairly brief, but we would like to hear from you. So please raise your hand, and I will, Steve, if you want to just call on people who are raising their hand.
Okay. And I have to find them.
I see Lizette. Lizette Steer was the first person, and Lizette, why don't you go ahead? I think that you probably could be unmuted and share your lessons.
You can talk now, Lizette.
We don't hear you, so make sure you're unmuted. I think we unmuted you, but you need to make sure you're unmuted too.
Can you hear me now?
Yes, we can.
Yep.
Yeah. So one of the things that's been really profound in the technology for me has been in Alaska, so much of the work that we did before COVID was by teleconference. And I just have to say, having had, I know we're all zoomed out. I know we've all had so many opportunities to Zoom, but it's so profound to be able to see people's faces as we're meeting and really be able to much better engage people on what used to be teleconferences and are now interactive. And the other thing I wanted to say that I think is very interesting that I've heard from providers, and I'm with AADD, which is the association, the Alaska Association on Developmental Disabilities, is how providers have talked about the fact that some of the individuals that they work with have actually been more verbal and more responsive using Zoom and the technology than they were face to face. And I think it just acknowledges how we all have different learning styles and learn differently. But boy, moving into the utilization of technology has been so helpful, way beyond telecommuting for me. So that's it. Thank you, Kim and Steve and Misty.
Great.
Thanks, Lizette. We appreciate that input. So I see a couple of other hands raised. So who's next in line?
Okay. Let's go with Marissa Jones.
Go ahead, Marissa.
Marissa, can you, are you able to talk?
I'm here. Can you hear me?
Okay.
Oh,
We can
yes,
hear you.
go ahead.
Go ahead.
Okay, what's the questions? I'm sorry.
You're coming through fairly quiet.
Yeah, the question is, what have you learned? Have you been using technology? And can you share with us an example of a lesson that you've learned as you use technology in your work with people or in your life?
Zoom with my clients with any appointment with the AMC. That's all.
Uh-huh.
That's the only thing. That's
Doctor's
the only
appointments?
way. Yes, doctor's appointment for individual.
Mm-hmm.
That's the only experience I had so far.
Okay.
Great.
So she was sharing doctor's appointments with individuals, that's been her experience. So.
Okay. So I was going to raise up Dwayne Mays. Dwayne, can you, actually, you should be able to talk now. Dwayne, you should be unmuted and able to talk.
All right, can you hear me now?
We can hear you.
Yes.
Okay. Super. Well, I was actually very excited when I saw this announcement come across. I think it was the SDS eLearner system. So shout out to Senior Disability Services for putting that out there. For me, technology is very important because I go back in time. I grew up in a deaf household, mom and dad deaf, and when they brought forward Sorensen technology so that you could do video phone calls with deaf people among each other, that was really a huge movement forward in terms of that connectivity. And so I grew up using video phone to communicate with my parents. So visually, very important. And then, of course, when I joined SDS, Senior Disability Services, we invested into the use of video conferencing systems so that we could see each other when we're communicating. And I think that really elevates and enhances quality of communication. So we made that happen. So today, given that COVID-19, I would say, I think we have about 86% of our staff are either working full-time or part-time using telecommuting, teleworking. And the systems that we put into place are working very well. We actually can see each other, working from home, see each other in person. So the question that I ask staff is, how is it working with our clientele? And what I'm hearing is because of the costs associated with transportation for low-income Alaskans trying to get to their appointments in an office, that they can save on those costs. The transportation system is somewhat limited now because of COVID-19. And so we are seeing increased connectivity with our clients through the use of this connection through video. So I thought I would share that with you. Thank you.
Great, thanks.
Thanks, Dwayne. Actually, Steve, before we call on the next person, I want to read out a comment that just, I think, really, it might have left. Oh, there it is. From Michael Butler. It's transformed technology. So it being COVID has transformed technology from an option to a necessity and the new normal. I don't think we'll ever go back from this move forward, which I think this really captures why we want to be talking today and gathering information. We probably will never go back to the way things used to be. And Dwayne, you make a good point about actually there's improved access because for some people. So go ahead, we still have some time. So go ahead, Steve.
Yep. Okay, so Cynthia Hensley.
Hi, this is Cindy Hensley. Can you hear me okay?
Yep.
Yeah, I have a couple of things. One of the things I wanted to mention that has happened, and I run a service providing agency here in Anchorage, since COVID, is not only are we obviously providing services in a different way, but our outreach is so much broader than it had been in the past. And I'll just use the example of Disability Pride. I'm on a planning committee for Disability Pride, and normally across the state of Alaska, we've had in-person gatherings, from southeast to the north, to here in Anchorage, to the peninsula. And this year we got an opportunity to step outside of that zone and go broad. And we went big. And we had Temple Grandin and Judy Heumann and really some, big hitters from the advocacy and disability movement who joined us from that. And if we had not had this opportunity to have technology in our lives, I don't think we would have naturally thought in that way, shape, and form. And so, and again, as a provider and reaching out to the individuals, and everybody's doing Zoom, we do have I love it, and I will never go back to, anything different. And then the folks who are like, I've got Zoom fatigue, it's a real deal, and I'm feeling really isolated. So we're really trying to find that balance and how we can support people in other ways. And the final thing I wanted to say about technology that, because again, we're all telecommuting, we have this ginormous building that we pay rent for, and it's not being used, and it hasn't been used for 6 months. And it really lends the thought to, well, if we haven't used it for 6 months, are we really going to need to continue to use it ever? Are we ever really going to go back to the way things were? And do we even want to? Right? So it gives us an opportunity to think differently and outside the box in the way we provide services. Do we want to go back to providing services that were, sometimes, and not always, we have a community-based program, but we often met in a setting. A large group of people came together in a setting. And it's like, do we really want that? And is that really the norm? Or is the norm really that we don't use a building and we meet in a more natural way? So it's given us a different lens to really look at from a fiscal perspective and then just from a natural perspective. So this is one of the pandemic perks, as I like to call them, that's really supported our agency, and I've seen it across other agencies, in having a different viewpoint. So that's all I'd like to say. Thank you.
Great. Thank you.
Thank you, Cindy. Yeah, that's one of the things that a lot of us have talked about is really internet access is becoming like community access and integration, and the opportunity to hear people from different places and connect with people in a different way. I see some comments coming in from Teresa Holt making a very good point about broadband, which we are going to address a little bit later in this presentation. So we still have some time. So I see some other people with hands raised.
Okay, Anthony Newman.
Hi, can you hear me?
Yes.
Hi, Steve. This is Tony Newman from Senior and Disability Services. It's good to hear from and see everyone. I'm zeroing in on that word rethinking in the question. I joined SDS when the pandemic and teleworking were already underway. And one thing I'm struck by is the number of people who said they were skeptical of teleworking and its ability to allow people to continue to be productive, but who are now believers that people can work from their homes and be as productive, and maybe even more so than they were before. So that's been interesting to see. And also on this theme of rethinking, I'm of an age where technology in the education system was always something that seemed to be just around the corner. It was going to be a bright future, but it was never quite here. but here COVID has kind of dumped a technologically based education system in all of our laps. And those of us who are parents and educators know that this has certainly been a mixed blessing. Even my kids who love their smartphones and social media have, I think, had enough and are eager to join their friends and their teachers in person. And there's a lot of sadness around that they can't right now. So those are my two observations.
Yep, and Tony, it really has struck me that, I mean, for the past 10 years or so, we've really been focused on community integration for people with disabilities. And it just seems like now more than ever that the technology is an essential tool for facilitating community integration.
Yeah. So who's another person? We still have about 5 more minutes to provide input on this topic, then we'll move on to the next.
Nona Safra?
Yeah, Nona. Yeah.
Hi. Oh, okay. I work with a lot of seniors, and in my visits to the senior centers, what I'm finding is those that have residents are using the telemed option, and they're finding it much more successful because those visits now include the caregiver that is on site, and the information is coming directly from the caregivers as opposed to a family member who maybe stops by weekly or even once a day, but will take the person to the doctor traditionally, but they don't know if there's a problem getting the medication to them or what the day-to-days look like because they're not there with regularity. So that was one of the really good points that was made, was that the doctors are better informed as to what's going on by having the caregiver there. And then the other thing is that the people are less stressed out if they have dementia or Alzheimer's because they don't have to leave their place and wait for a ride and be in a waiting office. And that confusion isn't there. They can stay in their place and have the service. So they like it a whole lot more. I had thought getting out was important, and it turns out it wasn't as important as getting out to socialize, but getting out for the medical visits didn't seem to do it for them. So I thought that was an interesting take. I'm hoping that in my veteran population that the visual does more for my veterans as they do intake than the online assessment does. Because when the veterans are doing that online assessment, somebody can't see the PTSD on their face or hear it in their voice when they're answering a multiple choice question. So I think that there are much more applications to come down that will be much more healthy on keeping people, you know, like from committing suicides when it comes to the veterans. And it's something they look forward to having and wish was in place now. So that's my input. Thanks for listening.
Great.
Thanks, Nona. Great input. How about 3 more? I think we can do 3 more.
Okay, so Jason Caputo.
Hi, thanks. Can you hear me?
Yep.
Yeah, so I work for the Division of Vocational Rehabilitation, and there's, I guess, 2 points that I wanted to mention that I don't think I've mentioned yet. One, as someone with a disability and chronic pain, personally, I found the pandemic to be much easier for me to do all kinds of things, including work and going to doctor's appointments via telemedicine, because all those things are painful for me. If I have to go physically there, riding in a car, sitting in a waiting room, sitting in a doctor's office, is, even with accommodations and things like that, it's still much less pain for me to go at home. And what the funny thing about it is that because I'm in less pain from doing things I have to do, I have more energy and time to be physically active in the ways that is actually helpful for me. When I do stretching and my physical therapy exercises, I can't do that as much when I'm out and about having to do errands and work. so I think that's important to remember that. I think on an earlier comment that had said, well, getting out to the doctor's office for some people might be good exercise, but for others, it's actually not helpful. It can be hurtful because you have to be physical in a particular way to get there. It's not necessarily the way that is helpful for your particular health condition, if that makes sense. And so that's been very helpful. I have much less pain and I'm much more productive because of that. The second way is as someone who is a team leader and a project leader at work, I found that we've come up with ways of course, we're using video conferencing, but we're also using software like Microsoft Teams to organize projects and give input through threaded conversations around the project, and kind of doing asynchronous communication. So we may be hashing out and brainstorming an idea, but not at the same time. I may have a moment to comment on a project or give an idea, and then a half hour later, someone else in the team will see that and comment. And it's much easier to do that using Teams than it is using email. It's all very organized. And one benefit of that I've found is some of my team members are extroverts. They're very good at raising their hand and offering information verbally, but others who also have fantastic ideas are less comfortable verbally giving that in a group over a video conference or telephone, but they kind of come alive in this asynchronous brainstorming where they can type their comments and have input. And so I'm seeing some of those people that rarely share their ideas verbally on a teleconference are now engaging much more frequently.
Yep, that's great. It's kind of what we were saying, I think, about the people with disabilities who are coming out of their shell. So
and we're seeing that actually on the Q&A, because we're seeing some really good comments that are coming up in the Q&A. People are taking advantage of that too.
Great. Yeah, I know there's been some comments about working from home is such a benefit for people with physical disabilities who need accessible transportation or supports. So we need to move on. So how about 2 very brief comments? So 2 more, and we'll keep it brief.
Okay. Yeah, so Karen, I'm unmuting or allowing you to talk, but we've also been noting that your comments, you've been putting some fairly extensive and very good comments within the Q&A function. So go ahead, Karen.
Oh.
Karen Brunello?
Do you see her phone number is 227-3661?
Oh, she's like logged in. 227.
Oh, and it's Barbara. So they're on a phone line, if you can.
227-3761. You can unmute it too. I'm not seeing that.
So while you're doing that, Steve and Kim, I wanted to share Rick Nelson from the Governor's Council sent us a message, and it was a really good point, and it was something we've noticed at ATLA a lot. And he said, I think technology has changed the way we work for the better. Working from home for a lot of people with disabilities has made being a part of the workforce much more accessible. A lot of people with disabilities didn't have as many opportunities to work before the pandemic because they weren't necessarily able to leave their house. But now that has all changed. And I know through ATLA, we work with a lot of clients through Voc Rehab and other arenas around the state. And we've also noticed that, and that's definitely been a pivotal change within employment for people with disabilities. So it's very exciting.
Yeah,
Thanks.
no, and it's interesting to think about it because I think it's different for different disability populations, because I've also been hearing like people who have hearing impairments, the fact that people are in masks and they're not able to lip read has been a major barrier.
Mm-hmm. So Karen, I think you're Barb, go ahead.
Yes, I'm good now. Thank you so much, Kim. And I did put a lot of information in the Q&A because I wasn't sure if I was going to get a chance to actually speak, but I'm Karen Brunello, I'm Director of Community Programs here at the ARC of Anchorage, and we've been providing distance delivered services for over 5 months now. So we've learned a lot along the way when it comes to helping people learn technology and to be able to access services and supports, which was challenging both for the individuals that we're supporting and staff initially, but it's been amazing to see the learning curve from the beginning until now, and individuals being able to share more personally with their peers in class and show things that they're working on in home or sharing their pets. We've been able to play a lot of different games with, you know, the writing and being able to do Pictionary and breakout groups. I think that I mimic everything that everybody has said so far. There's been a lot of seeing leveling the playing field and taking turns and waiting your turn and allowing others to, who were typically more quiet, you know, watching them blossom and speak up and be able to be more active in group settings than they may have been in in-person settings. So it's been interesting to see the different personalities. Everybody kind of feels like a movie star on Zoom because you're on screen. And so that's really brought out a lot in the individuals. There's also definitely some challenges along the way, though. We've been talking a lot about the pros, and you can go back and look through my comments. I do want to talk about some of the challenges, though. A lot of the individuals have struggles with internet connection issues, or if they don't have somebody at their home with them to help them log in and log out. Some individuals don't have the dexterity or the ability to do that. We learned that with breakout rooms, that they work really great, but that's not accessible for everybody if they aren't able to enter the breakout room, those types of things. We are a little bit more limited with some of our projects, specifically some of our art things, but we have been able to do a lot of projects with home materials that individuals already have, and being able to be creative with the resources that you have, which has been really exciting. Our biggest challenge, though, to be honest, is, you know, because I work in a rec center and that we primarily build day hab for the services that we're providing. And so Appendix K has been great, but we were finding with some individuals we're having to submit 2, 3, maybe 4 Appendix Ks because, you know, what their needs are is changing based on the pandemic. And so an individual who might be able to do group services on a Zoom class, but then now is able to do some one-on-one in the community, but not ready to do group in the community because of the health and safety aspect. And so being able to flip back and forth based on the needs of the individuals and trying to reduce the amount of paperwork to be able to meet their needs would be extremely helpful.
Thank you, Karen, so much. I think that's a great comment, actually, to move on to the next piece. And I know there were other hands raised, so please put your input into the Q&A, but I'm glad you brought up challenges and the need for flexibility, because that's some of the lessons that we need to think about. How do we take this and move forward? So Mystie, I think that we'll go ahead and move on to our next section.
Okay. Great. So one of the things that, as we were preparing for this, I'm a big advocate in taking the time to just shortly explain exactly what assistive technology is, because the definition of assistive technology is so broad. It's a huge umbrella, and it's basically any service or device or piece of technology that would help someone overcome a barrier. And that's the simplest way to put it. But a lot of people immediately consider it as high tech, or, you know, our smartphones, or they think of somebody needing augmentative communication device, something very computer related or anything like that. But it's not always that. And when you call ATLA, or if you're working with ATLA, one of the very first things we consider is we go through a continuum with AT, and the very first thing we always consider and think about are all the no or low tech devices, or ways that we can kind of do that DIY. And we've been very creative in some of, I mean, I've used rain gutters, I've used sandpaper, I have just went way outside the box to come up with ways to provide AT to people. So for those of you on the phone, some of the things that I have on the slide right now, it's a very low tech, no tech visual schedule. And we have a system that will do this to print it out, but just super short, quick little story. I had somebody call saying, oh, an Alexa will work great for my dad. You know, he'll love being able to do it, and we can set up reminders and tell him when he needs doctor's appointments and things like that. The issue is he had Alzheimer's and dementia, so he couldn't remember Alexa's name and why that speaker was actually there and why it was talking to him. So we just set up a really simple visual schedule with symbols. And a lot of times that's what we need to go back to. And yes, we've done this with people where English is not their first language. And so symbol-based things are a lot easier. Some of the other things that are on this picture or on this page that are no tech are the old foam curlers that you can get at the dollar store. You can buy like a bag of about 50 of them, pull that foam off, and you can put it on a pencil. It slips onto utensils, and it makes it easier for people that have any kind of dexterity impairments or arthritis, anything like that, easier for them to hold it. So there's a couple ideas. Then once we think about the no tech, low tech, we go into a mid tech range. And with mid-tech range, these devices usually require just a little bit of training, sometimes a little bit of setup, and the pricing for this, of course, ranges all over the place. It may have some electronic components to it. Sometimes it doesn't. On the screen, I have some really bold type keyboard. So it's got bright contrast, it's yellow, and everyone that comes in to our office, back when people were able to come into the office, they would all see the big keyboards and say, oh, that's what I need, is one of those, because they're really cool. Digital magnifiers, in this area, this is where we work a lot with seniors or people with traumatic brain injury, working on med management, not necessarily something where they have that 24-hour caregiver, but maybe they just need something to remind them, and a device that will remind their family or notify their family if they don't take the medicine. So it's a wide range of things. And then the last area that we really consider is going into the high tech. And this can be a lot of smart home. That's very popular right now, and I don't foresee that ever going away. It has its own challenges. Of course, you have to have internet, but are devices that can open doors. And one of the things that I've said to a lot of people is it's wonderful to put a ramp in someone's home, but we need to be able to provide them with assistive technology so that once they go up the ramp, they can actually open the door or leave their home. And of course, iPads are very popular in any smart tablet device. On the screen, there's Alexa. The computer is it's not just a regular monitor. Those are devices that people use their eyes, and they're able to type, they're able to run their home, do just about anything with an eye gaze system. And then the device in the middle, it looks like a virtual reality device, but it's called a virtual device. It's for people that are blind or very visually impaired. And when they put that on, if they look at a piece of paper and it has print on it, it reads it to them. When they look up, it'll identify everything in their surroundings. So even if they're blind, if they put this device on, it has audible output in their ear that tells them what they are looking at or reads devices to them, and can help them if they are having trouble navigating either around their home or wherever. So, I mean, the range of assistive technology is incredibly broad. So the thing I also want to make a point of, like I said, we do those solutions. They go from that no tech all the way up to the high tech. But on the left of this slide, I talk about the services. And I kind of feel like I'm always on a soapbox about that because 15 years, I've seen a lot of people maybe watch a 2020 special or talk to a friend and they say, you know, my friend's child has autism and they got him an iPad and now he's able to communicate. And it's not a one-stop shop. It's not as simple as that. You have to have the services and have a qualified AT specialist that works with you and or with the person. So they're extremely important. And as you've probably seen within the chat, and you'll hear us talk about more, the training and the support is incredibly critical. There's a term within our AT world called assistive technology abandonment. And we see it quite a bit because people get a bad experience with a piece of technology, and then we have to work with them to kind of overcome that experience and let them know that we're there to help them and support them and that it won't be as bad. They'll have a good experience and that it will help them overcome those barriers. So I believe the next thing is we have another poll for you guys. So let me bring that poll into view.
They have that poll actually, they see it on their computers, it's popped up.
Okay.
So we were thinking
yeah,
having
additional
webinars, and we wanted to see if there's additional things that you wanted to learn more about.
And also, if anybody isn't sure what some of those areas are, environmental adaptations, that's not your air conditioner. It's actually ways for people to control their environment. And within learning, cognition, and development, that's an area that some people, it's not just our students and their learning, it's also within cognition, it's Alzheimer's, dementia, anything within that.
Okay, and I think we can go ahead and end the polling. Well, we got a few other people coming in quickly. So we'll just give you a few more seconds for the poll.
And somebody asked if we could read the question out loud. So it says, if you're interested in additional web-enabled calls that provide more detail on assistive technology, please choose from the topics below, or you can enter that information in the Q&A.
Okay, I'm going to go ahead and then end the poll. And we'll share the results. So only 10% of you said that you didn't want any additional calls. So it seems like there's a large interest in additional calls.
Sounds like we're very busy soon.
Yeah, with the plurality being for learning, cognition, and developmental technology. Next highest seems to be computer related, and then daily living, or excuse me, environmental adaptations and daily living. Great, thank you, that's very helpful.
So some of the current funding that we have available, I'm going to talk a little bit just briefly about some of the things that we have at ATLA that are available. As I mentioned at the very beginning, ATLA is multi-funded. We are funded through state, federal funds, private foundations, several other ways. So we have right now Alaska Relay, and first of all, let me back up and say anyone, any disability, any age, and it doesn't really matter if you are quote unquote been diagnosed with a disability. We have people call that say, you know, I know that I have a learning disability, I have ADHD, what do you have for AT? And so there are no major qualifications just to generally work with ATLA. However, some of our programs do have very specific qualifications. So we have Alaska Relay that provides assistive technology for people that are deaf, hard of hearing, or have a speech impairment. And then we have Alaska Can Connect, that's very specific to people that have a progressive vision and progressive hearing loss. So they have to have both, and they need to be progressive. And then our AT Acquisition Assistance Program, that one has no qualifications. It is a process where my ATAP, we call it ATAP coordinator, works with you, your doctor, your individual, your family, whoever you want, and will help go through that complicated funding research process. And if the person needs assistance, she will write the grant, the mini grant. She will get the support letters from speech pathologists, doctors, whoever she needs. And it's not a guarantee. There's definitely some areas that we have difficulty finding additional funding for, but there are also a lot of areas that have funding out there that people aren't aware of. And so that's one. And then the last one is Techability. And that's the one that we've worked quite a bit with Kim lately on. It's a appropriation. It's supported through the Mental Health Trust, and it's to provide low, mid-tech assistive technology to beneficiaries, to Alaska Mental Health Trust beneficiaries. And then we have several more. We have one specifically called Agri-Ability, and it's to provide services and assessments for people within a very broad definition of agriculture, including master gardening, logging, fishing or fishability. And then we have other fee-for-service. So like I said, we are a community rehab provider for the Division of Voc Rehab. And I would say the very best thing to do is, if you know of somebody that needs assistive technology or you want more information, to call or email. We'll do everything we can to help people get the AT they want. And so now I'm going to turn it over to Kim, and she has a few more that she wants to talk about.
Yeah, and this is, I wouldn't say this is an all-inclusive list, but there are some COVID-specific funding opportunities now that are only available because we're in a health emergency. One is the Alaska Association on Developmental Disabilities has a partnership with the Mental Health Trust to provide both capacity building for service providers. So that's the learning curve, providing training and technical assistance to help people like you heard from the ARC of Anchorage and Cindy and Vix that have been doing distance delivered services. How do you do that? As well as providing devices to people. I will say I've really gotten to know ATLA through this project and have been so impressed with their depth of expertise. They're going to be an important partner moving forward on this. You heard about Appendix K mentioned for people who might not be aware, for the Medicaid waiver providers who work with seniors and people with disabilities, there's been this temporary allowance for services being delivered via whatever, video conferencing, usually Zoom. And you heard a little bit about that touched on. Most of the services being provided are day habilitation or supported employment with a little bit of supported living or in-home or adult day. And then behavioral health also similarly has a telemedicine emergency response policy where services, behavioral health services are being provided either through video conferencing or the phone. And again, right now, some of these funding streams are temporary. And I think that is part of the impetus for our conversation today. We've heard a lot of positive feedback and input about how technology can really level the playing field and in some ways make quality better. We heard from Nona saying, you know, the providers are actually better able to serve people. But some of these things are temporary. So we do have another quick poll about if you want to learn more about the funding options. Then we're going to actually, the rest of our presentation is going to be really looking ahead. So this poll, the question is, what would you like to know about current programs that fund assistive technology? and who is eligible, what types of AT are available, the application process, and other.
And Kim, while the poll's active, there was a question in the Q&A about, can you tell us what types of devices Mystie supplied for people whom you serve?
So Mystie, what types of devices do you mean?
That question was for you, Kim. What kind of devices have we been providing for you?
Oh, great. Sorry. Actually, it's really been primarily iPads with some exceptions. For some people, a smartphone makes more sense. The goal of that particular project has been to keep people with disabilities connected during COVID. So people who needed to hunker down and be physically isolated and distanced, we, with ATLA, have been able to provide them some vehicle for accessing distance. And it's almost all been iPads or smartphones. Wouldn't you say, Mystie?
I'd say so. I'd say there have been situations where we found out people already had technology in their home. They just weren't thinking of it as AT or didn't realize that they could use it that way. And so it was kind of more of helping them, walk them through how they could use their own device that they had. I would say for our COVID rapid response project, majority of it has been iPads, but also I would definitely say that there are at least probably 50% of those people that we found other AT in other areas of their life that they needed, or we were able to almost use 3 or 4 of our programs to help them in several different areas, not just in that specific distance communication or distance support that was the purpose of that particular program.
Right. I want to add on to that. One of the things when Mystie and I first worked with AADD on this project proposal, Mystie said, you know, we probably know a lot of these people. We have thousands and thousands of people in our database because we've been around and worked with people. And almost everyone who's applied through this AADD program has been new to ATLA and has not been introduced to their level of expertise. And it's just shown that we have not necessarily reached out to populations. And I think it is sometimes about expectations or, you know, thinking in a certain way, which is the next piece I want to share. Really quickly, I'm going to need to move quicker because I really want Steve to have time to share some options. But our poll, what type, that looks like the biggest interest is what types of AT are available, and then followed by eligibility and application process. So,
and yeah, there was a couple of questions also that came in the Q&A that we can answer via typing it in on there. For the people who typed other in there too, I would encourage you also to enter what particular other topic that you would like us to address in the Q&A so we can potentially add that to a future call.
Great. So Mystie, could you move it on to the next slide? So now I'm going to talk a little bit about, you know, as we move into, and I wrote down this comment somebody made saying this collective pivot, as we all in the world collectively pivot towards how does technology, you know, shape our everyday life. There are some things that I've learned particularly through this AADD rapid response project and some of the other projects I'm involved in. And it really is a service culture. Just like I think somebody had said early on, I think it was Tony Newman was saying, oh, people were really sure about teleworking. You know, will people be productive from home? And then when they're forced to do it, they find out, wow, people are actually productive. Right now, our service delivery systems, for the most part, are very focused on in-person support. Funders are, it's tied to being physically present with the person. And this culture was developed decades ago before we had the technology we have available today. So it's a real culture shift. And building in so if we aren't going to be with a person physically, how can we make somebody available when they do need support? Because it's not about people not needing human support. It's being more focused and using it more efficiently and effective for those moments when they need somebody. And I'm going to move through this quickly so we can move on, but I know this will hopefully generate some thinking. There's a whole range of skills that need to be developed. And this is where Mystie had said earlier, are you going to talk about what the learning curve? So not only So people with disabilities need to learn how to use equipment, and they can, but they do need support. And then sometimes the family members or the staff who provide that daily support to people really are not comfortable with technology and don't have the skills. And then even the organizations that, you know, who are providing services and kind of overseeing services via technology, they really have a learning curve as well. So anyway, sorry, I'm getting getting distracted by a message. But so we need to really figure out how do you increase skills and troubleshoot those technology challenges and those learning curves. And then there's an infrastructure issue. And early on, I saw comments around people's access to the internet. And I don't know, I know this now, I didn't know it 6 months ago, but the driver of expense of internet in Alaska is really how far you are from the middle mile, which is basically the internet highway. And Alaska has some very big spaces. Now, what we have found is some service providers who said, oh, we used to provide internet to people that we serve, and we got so much over usage, and people really were getting into websites they shouldn't, that we no longer provide that, and we won't get into that. But then in meeting with internet service providers over the last 6 months, the internet service providers have really built their capacity to help manage services and being able to manage data usage and also filter out websites and concerns there. And then, but another piece of the infrastructure is how do you purchase the hardware? How do you access the expertise of ATLA? How do we pay for that support? How do you replace hardware once it breaks? And then who maintains it? And so again, things to think about as we change our system. Were there any comments or questions, Steve, that you would add?
Just kind of an emphasis. Somebody in the Q&A, Terrace, was saying that the access hardware is just part of it, that the service plan and faced with the hardship like internet and stuff like that is really important.
Yeah, there's definitely a digital divide. And we need to figure it out. Like, we have to figure it out. And again, technology is changing where we're going to have satellite infrastructure, not in the so distant future, that's going to make it more affordable. So I think we'll just move on. I think we might have another poll. Yeah. So how important do you think it is to add AT or technology to Medicaid, or even generally, like, to figure out funding sources? Is this where we're at this point, and are there other things we also have to figure out as well? And again, add your specific comments in the Q&A. This is an opportunity for us to gather input and feedback on where do we go from here. And I'll just mention while we're filling out that poll, we also are in a place where we have opportunity to look to other states that are maybe ahead of us. There are some states that have already identified themselves as technology first and are building these systems into their funding mechanisms. So that's something that in just a moment, Steve is going to share some of those opportunities and options that are available. So it looks like this poll is really, it's a runaway favorite. Maybe not.
And I'll close the polling in just 1 second. I'll give you 10 more seconds. Okay, and I'm closing the polling and we'll share the results.
Yeah. So yeah, over 60% say it's really an essential service that should be covered, followed by 28% saying it's very important. And so again, put your specific thoughts, especially the people who said, well, maybe that's limited importance. You know, what else should we be thinking about? Because again, we want to make sure we're really in touch and it's a conversation and we're working on it together. So.
Okay. Okay, now on just to talking about some of the Medicaid options within it and to think about some of the options for the financing within those. So the most obvious one that has already come up is adding that coverage under the waivers. And see if you want to go into the next slide. So you have a lot of flexibility under the 1915C waivers, and the state also has some control in terms of who might be able to access it. So it could be added to any of the existing waivers and it would allow you to tailor the benefit to any of the waivers. So an advantage within that is you could choose which waiver that applies to and tailor it to that waiver. So like on the IDD waiver, you could offer different types of a different type of benefit than you might be offering under a CCMC or under the ALI. The next obvious one is the community first choice, also known as the 1915K, which also would apply to anybody who's eligible for any of the waivers, could be getting assistive technology under this option. A big advantage of that is that the state gets an enhanced match of 6%. And because it's changing the roughly 50-50 to now 44-56%, that it actually equates to a 13.64% increase for every dollar you spend. So if previously you were spending you know, you got $1 worth of services. If you were funding it under Community First Choice, you'd have nearly $1.14 worth of services. Now you can vary the benefit based on the need of the individual, but you can't vary it based on the diagnosis of the category. So you couldn't like have special services that were only provided to people with IDD. You could do things like by targeting services that are aimed at people with visual impairments to only people with visual impairments. So you would be able to do that. There are some other choices that could be considered. In addition, you could add it to like the state has the existing 1115 demonstration waiver, and it could be added within that. And that would be much more simple than doing a new 1915 demonstration waiver, which would be very burdensome, and you probably wouldn't benefit from having anything in addition to that. You potentially could add it under the Medicaid rehabilitation option, which typically offers you a little bit of less flexibility. There's more pressure for it to be medically necessary than under the traditional waivers. We can switch to the next slide. EPSDT, which is the program that serves children, that anybody under 21 is entitled to those. Limitation is that it only applies to children, and it's what can be covered is somewhat blurry. It's generally, they have the definitions of things being more medically necessary. So if we're looking at technology that is solely focused on community integration and so forth, you don't have as good of an argument to be able to cover that as you do under like a 1915C or under Community First Choice. And then also the regular Medicaid state plan, you potentially can cover some of the options within that. There is more pressure under this to justify these services as being medically necessary, and it's something that it works best for items that are currently covered under Medicare, that CMS is more comfortable with that than under other components. Okay. We can start our next poll, which is just, you know, what else do we need to be considering when we're thinking about integrating technology more permanently into our service delivery systems? And you can just select all of the things that you think apply.
I know there's at least one person who's not able to use the poll. And again, if you can enter the information in the Q&A or chat, or you can always email any of us after this presentation, and your input will be very, very much added into the conversation today.
And Leona Marks, you have your hand raised, so I'll allow you to speak.
Oh, I didn't mean to raise my hand, sorry.
Okay.
So there is a question, Steve, then I think between you and I, we could probably answer this. Sarah Gold asked, what does Medicaid not cover that would be essential or enhance lives in a great way?
Yeah,
So
and that's,
do you know what Medicaid covers right now as far as assistive technology?
yeah, I mean, there's a big, within Medicaid has traditionally been a medical program. So it's been supplying medical needs, and then the criteria has been what is medically necessary. And being able to integrate with the community, to have a job, to kind of live the life that you want to live, and under the things that we've really come to emphasize under a person-centered approach, that's not generally considered medically necessary. Under the home and community-based services, and with the home and community-based services rule that came out in 2014, there's been a shift where they've kind of been emphasizing things like community integration and full participation and other components within those. And that allows for a great expansion when we're thinking about technology beyond what is medically necessary.
So I know from my own experience that the only thing I have found that Medicaid waivers do cover are speech communication devices, usually very high-end speech communication devices. They do not cover things like an iPad with a communication app on them, which usually is around, you know, $1,000 to $1,200. It's devices that come from places like PrintKey, Romic, or Tobii Dynavox, and most of those devices start out around $12,000 to $14,000 a piece and go up from there. Some switch access to them devices, but other than that, there's no other AT that I have actually heard of within that they've paid for.
And it's also important to recognize that medically necessary is somewhat of a subjective criteria, that it does really depend upon the reviewers that are looking at it and the guidance that's given to those reviewers by the state and the federal government. Okay, so I'm going to end the polling on this and share the results. So it looks like all of those came up as major barriers and around the same place, especially expanding access to low-cost, high-speed internet, which is a key component now that it seems like access to internet for community integration is extremely important nowadays.
Yeah, I would add, I forgot to add this about the internet access. I did do some exploration on where Alaska is at, and there is actually somebody within, I don't know, I won't say it, but somebody in state government who's focused on expanding internet access, and the Denali Commission has been an important partner on that. And one of the things I was talking to the person at the Denali Commission, Eric O'Brien, who's a huge advocate of internet, says the message has to be, it's more than Netflix. It's more than access to Netflix. And that's what, and I think we all then can be advocates around internet access because it's beyond our group here. I want to just, yeah, well, we are going to open it back up to some more comments, but I wanted to just address a couple of the comments that I saw in the chat. And the questions, I think that they're so incredibly important. I want to bring them to the attention is, you know, what will we have to give up in this era of economic uncertainty or limited resources to add technology, and that there's families who are concerned about embracing technology because they might lose service. And I think that we all have, it's important to think about flexibility, and that there's opportunity for people to be more independent and get a lot fewer services than they currently do if it can be intermittent as needed instead of 24-hour with somebody right there. And we have the information from other states, recognizing that there are people who will always need that human support. And I think that right now is as we make the pivot, it is thinking about that. It's how do we balance that, where we can implement some resources around technology that will reduce the cost of serving people and make them more independent, while maintaining the resources needed to provide in-person support. But holding on to that in-person support because you're afraid of losing it completely instead of engaging at some level with technology is going to hold us back from really moving forward. And I think that we need to address it head on and acknowledge it and then figure out how to address that. So I just wanted to share that because that is something that does come up frequently. But I do think we wanted, let's see, we have about 7 or 8 minutes. So if people who didn't get a chance before want to add now that you've seen all the information that was presented, or if you have questions, we are opening it up.
Okay, and Eric, I've unmuted you.
Hi, I just wanted to address what I saw in that last poll there regarding the high-speed internet being probably the most important issue to most people. I really don't see that as the primary issue when we're introducing these technologies into our communities. There are a lot of places where the infrastructure for something like high-speed internet connection just isn't there. You're talking about remote Alaska, you know, and over time that infrastructure is being built and will be built into those communities. We have emerging technologies that are bringing high-speed internet to more rural locations every single day, you know. So I think what's much more important is that we train up the people utilizing the technologies that we have currently that are currently available to us, and make sure that we as providers are trained to a point where we can properly train and properly educate the people that we're trying to use these technologies with. Thank you.
Thank you, Eric.
Anybody else wants a question or comment, please just raise your hand and I will unmute your line.
And there's been, in the questions that we've been getting in, there's been some themes around what inmates might qualify for, if there's any funding available for incarcerated population. So Mystie, I'm not sure if that's anything that ATLA would have anything available for.
Absolutely. Like I said, it would probably be best to call me directly through work, and so I can get more of the background information, find out where the inmate is and what the needs are. I would say that the limitation is more on the facility or the situation more than it's on ATLA. If that person qualifies for any of our programs, that's not a limitation within any of our funded programs. The only limitation would be on the other side. So give me a call. I'd love to work with that.
And then Mystie, one other question that came up in the chat, and maybe you would be helpful in answering this. How do we distinguish between dementia, hearing loss, or fear of technology being the primary barrier to an elder using a device?
That one, that was Marianne maybe. I might be saying it wrong, sorry. I would say give us a call, and the way that we do it, and because we run into that situation quite often, is again going through that continuum of that, working through kind of the very low end of the mid-tech things and seeing how that goes. And it's a process, but I've also can tell you there have been countless times where we have thought, okay, this person has such a fear of technology, we're not going to maybe be able to help them. And when we were able to introduce the right technology, it was a 180-degree flip. And I can't tell you how many stories I have of seeing that happen. So please give ATLA a call, let us know, and we'll try to help the best we can.
And Dwayne, I've unmuted you. Dwayne Mays, go ahead.
Can you hear me now?
We can now.
All right. I did put this in the Q&A section, and just to full disclosure, I talked to Mystie a couple days ago, but maybe as a future workshop or presentation, you would want to do it on how do we use technology, because the pandemic is here and it's going to be here for a while. And so when people start going back into the office, how can we use technology to keep our employees safe? So in the Division of Vocational Rehabilitation, you have your counselor offices, but then we do evaluations and assessments, and we have these large scale assessment rooms. And so I've been thinking and talking with the Department of Labor leadership about the use of technology to keep our employees safe. I think that would be a workshop that would sell out if you put that together.
Great, thank you. Now, bet Jason Caputo.
Hi, yeah, thank you. So I don't know if this is already on the radar, but as far as, you know, getting internet access to different areas, especially rural areas, it would be interesting to find out the lessons learned from the OWL project, the Online with Libraries. If you're not familiar with that, they invested quite a bit of money in getting libraries, I think 150 libraries across the state, access, updating the infrastructure, getting techs trained on site, and the libraries would offer video conferencing services. And in some cases, we started at the DVR, we started looking at using those to provide, excuse me, distance counseling. This was a few years ago. And we saw some real success with that, providing distance counseling to clients who didn't have internet at home but could go to the library and either use it after hours because of the confidentiality issues or things like that. There were some roadblocks. The roadblocks, there was some fragmentation on how it was implemented and things I think that kept it from being successful, but it seemed like something that could have been really successful to get internet across the state if there was just a little bit more support for it. So that's Online with Libraries. And I know that there was a project coordinator with the state library division who seemed to keep meticulous notes and things. So I bet there's some lessons learned on options for providing internet.
Great, thank you.
And there was just one more.
Sharon had an excellent comment, just talking about how you know, many people aren't aware of fully the capabilities of their smartphones. So consider providing training, better training to people about how to more effectively use the technology they already have. Others, anybody else that want to ask any questions or make any final comments?
All right. Well, I'll go ahead and close things out then. I want to give a huge thank you to Mystie Rail, Kim Champney, and Steve Lutzky for the fantastic presentations and the interactive discussion today. I learned a lot. I learn a lot every time I talk with any one of you. So having all three of you together has been fantastic. And I look forward to future conversations. On behalf of the Alaska Mental Health Trust Authority, thank you to everyone who participated. We'll leave the chat function open for a few minutes before closing out the webinar. So please, if you have any final comments or questions, please add them. I've seen a few comments come through asking about questions to be published along with the session. So we will work to make that available on the Trust website, but that might take us a little bit longer than posting the session. So maybe check back in about a week and we'll have most of the answers prepared for you and available on our website. Thank you again for participating. Check the Trust website for the recorded session soon and Q&A to follow. Have a great day.
Great. Thank you all for attending.